providing care of a client receiving non-invasive ventilation, bag valve mask. Patient is not breathing with an adequate rate and depth, or if the patient has lost the respiratory drive, a bag and mask may be given to provide an oxygen until the patient is resuscitated or can be given an endotracheal tube. A bag and mask devices are referred to as Ambu bags or can be also named as bag valve mask devices. Equipment: handheld resuscitation device with a mask, oxygen source, disposable gloves, goggles and mask, and additional PPE if required. Assessment: assess the patient's respiratory effort and drive. If the patient is breathing less than 10 cpm, or if the patient is breathing too shallowly, or if the patient is not breathing at all, assistance with bag valve mask may be needed. You can also assess the patient's heart rate and rhythm. Bag valve mask is used in many crisis situations. Manual ventilation is also used during airway suction. Special consideration: air can be forced into the stomach during manual ventilation with a mask, causing abdominal distension. This distension can cause vomiting and, if possible, aspiration. If the patient starts vomiting, you remove the mask and wipe the vomitus as possible, then resume ventilating.
The tool of choice to ventilate a patient is a bag valve mask. The device consists of a face mask, a one-way valve, and a bag. Many bag valve masks will also incorporate an oxygen reservoir as well. When utilizing a bag valve mask, the EMT should always utilize manual airway techniques, airway adjuncts, and supplemental oxygen to deliver high concentrations of oxygen to the patient while ensuring a patent airway. Do not hesitate to suction the airway if necessary. Also remember to take appropriate cervical spine stabilization precautions if warranted. Assembly of the bag valve mask is relatively simple. Begin by expanding the bag itself. Attach the oxygen reservoir bag if included and the face mask. Attach the oxygen tubing to the bag valve mask and connect the other end to the regulator on an oxygen cylinder or to a regulator within the ambulance. Ensure the oxygen supply is on and set the regulator at a high flow rate, typically 15 liters per minute. If the EMT is functioning alone, he or she should use the EC technique for establishing a face mask seal over the patient's face. Grasp the face mask using the palm, thumb, and index finger to form a C over the face mask. Place the face mask over the patient's nose and mouth. Utilize the remaining fingers under the patient's jaw to form an E and anchor the hand to the face. Squeeze the bag with the other hand, delivering enough air to produce visible chest rise in the patient. Release the bag and allow it to refill with air. Squeeze again and repeat as necessary at an appropriate rate determined by AHA standards or local protocol. If at any time chest rise does not occur when the bag is squeezed, reassess the equipment, technique, and patient. In some instances, the rescuer failed to maintain an adequate seal between the face mask and the patient's face. In other instances, the patient's airway may be occluded given a foreign body or improper positioning. When available, a second rescuer should be utilized to assist in bag valve mask ventilations. The second rescuer can utilize the EC technique with two hands to ensure a face mask seal over the patient's face, while the primary rescuer can use two hands to squeeze the bag.